Hi everybody, and thank you for joining this first session with our colleagues from the IGPM in Wales. So we're hoping to be here for about 45 minutes. We'll be talking to Gareth, who I'll introduce you to in a second, and just to kind of get some more interaction from you, we're using something called Mentimeter. And if you go to www.menti.com, menti.com, and use the code 29813102, you'll be able to join in, ask questions, answer questions, and we'd love to know where you are on this first slide. So you should be able to put a little dot on the map where you are. So www.menti.com and 29813102. Now it worries me when nobody has put their dot on the map. Now then, is that Gareth? No, not Gareth. So that's somebody else then in South Wales.
It's Joe in South Wales.
Oh, hi Joe. So at least one of you has made it work. A couple of people in South Wales, great. I'll just give it another minute and see if anybody else is out there and can make the technology work. If you can't make Menti work, you could always put in the chat where you are. Oh, brilliant. Okay, so we've got someone in North, someone in West. I'm quite jealous of that West Wales one because I bet that is a beautiful coastline to live nearby. Amazing. Thank you so much. That really helps us to know what our spread and our engagement is like. Oh, Anglesey as well. Wonderful. Hey. Thanks, everyone. Okay, so just to reintroduce ourselves, I know we've met lots of you before. My name's Kay and I'm a practice manager at Alvanley Family Practice, and that's in Stockport. Now, we've got Joe with us today.
Hi all. Yeah, thank you. Hi, I'm Jo Wadey. I'm absolutely delighted to be meeting you all today. It's amazing to come and meet our Welsh colleagues. So thank you. So I'm down in West Sussex in Worthing, along the sort of southeast coast. It's fantastic to meet you all. Thank you so much for joining us.
And we've got Robin with us as well.
Hi guys, yeah, so I'm a bit closer to Wales. I'm just on the other side of that godforsaken bridge in Bristol. And I'm headed to Wales actually next week on holiday. So as I've put in the chat, any tips on things to see in Pembrokeshire, I'd be much appreciated.
Thanks, Robin. And we've got apologies from Nicola today. As we know, anyone who works in practice management are superheroes. Nicola has been a double superhero this last few weeks. She's been the practice manager and she's been the dispensing manager at her practice. So, you know, really our thoughts are with Nicola because I know she's working double and treble shifts. So the thing that you'll have heard from the four of us is that we're all practice managers, but we're also all English practice managers, and as much as we can try and understand what happens over the border in Wales, we know that we weren't getting things right. So we have a group of regional reps that support us as the directors of the IGPM, and we asked our representatives of Wales if there was a volunteer who would like to become an associate director. So I am delighted to introduce you to Gareth, who I'm sure some of you might know. Gareth, do you want to say hello?
Hi everyone. I hope thanks for joining us today. I think today is quite an important step for us practice managers in Wales predominantly, so that we can try and get a collective voice together. And obviously work with IGPM to take things forward. So thank you for joining.
And really great credit to you, Gareth, for stepping up as well, because this isn't a paid role. This is something that we do as volunteers at the moment while we're building up our membership numbers. So Gareth has joined us, I think officially from the 1st of July, maybe it was the 1st of June. Was it the 1st of June, Gareth?
1st of June, yeah.
Yeah, 1st of June. But in the background, Gareth has been working with us for over a year and helping us to sort of try and get things right. But what we want to do is have Gareth's real expertise on the board. And then our plan following that is to do a similar, learn from how we do things in Wales, and then perhaps replicate that in Scotland and Northern Ireland. The benefit of the IGPM is that we are a UK-wide body. We're run by practice managers and we support managers in general practice. So that could be a PCN manager, not excluding any of those. And it could also be someone who's an operational manager or a finance manager. So our big question for you really, back on Mentimeter, or again, you can do it in the chat. Do you think we need a representative body? Oh, well, this is music to our ears. All yeses. Oh, well, let's see by the end of the session if they're not sure, changes their mind or can feed back to us of what we might be able to do to change your mind. What is it? What are the actions that you would expect? And then just to really think about this thing called accreditation and understand if you think that's important for practice management in Wales. And we'll talk about this this thread going throughout the next half hour or so. So Robin, do you want to just say a couple of sentences about accreditation and where we are?
Sure. So accreditation was something that came out quite early on in the IGPM's inception. We were told by the wonderful people at NHS England that practice managers are not a professional, well, basically not a profession. And part of that is we don't have a professional body and we're not accredited. And then, this was something that we were concerned as an opinion that's being held across the UK and the devolved nations as well. And so what we decided to do was, counter both of them. We set up a professional body and we've now set up an accreditation framework. And the framework itself isn't just about making sure that we are professionally recognised for what we do. It also acts as a framework for career development. So if you're a new practice manager or an aspiring practice manager, or you've got a succession plan in place and you're looking for somebody to develop, they can use that framework to get an understanding of what the job is and what sort of training they'll need to complete to be able to meet that standard. And it also acts as a sort of recruitment standard as well. This is the role of the practice manager or managers working in general practice. This is what it entails. This is how varied it is. This is how challenging it is, but also how rewarding. So we can use it as a tool to encourage people to apply or to consider practice management as a career choice, but also to demonstrate to the powers that be, whether they're our partners, our health boards, wider organisations, that actually this is what we do and how important we are. So it's sort of working on a multi-faceted level. Feedback so far has been really, really well received. So we're really keen to hear from potential members and existing members as well, what they think about it and who's willing to go through it as well.
Thank you, Robin. And the directors and a total of 12 people have been through the process, and now that is opened out to wider and all of our members. So Gareth, spotlight on you now. I'm going to go through a series of questions just to kind of start our conversation, and so we can have a chat about some of the things that are important to you and to the managers across Wales. So why do you think it's important that Welsh practice managers are represented on the board?
Yeah, so thanks, Kay. I mean, from my personal perspective, it is really important that Wales gets a voice represented on the IGPM board. Wales is a devolved nation, health matters are devolved, and we need to have a voice as a national body. And examples of this are already seen with BMA Wales, RCGP Wales. And it's also important to get practice managers' views in Wales taken on board and highlighted at relevant board meetings.
Great, thank you, Gareth. And you've already started doing that, haven't you? You've started conversations with the RCGP Wales, for example.
Yeah. So early discussions and engagement with the relevant bodies to sort of highlight IGPM and the work that we're doing at the moment, not across the UK, but also specifically more in Wales. So.
Great. So that kind of brings us on to what we should be called, because we want to really recognise that you will be a kind of subgroup, sub-organisation, but still very much under our umbrella. So Gareth and I had a chat yesterday and wondered whether we needed that W or we needed Wales in brackets, or you're just happy with the Institute of General Practice Management. And if you've got any ideas of you know, another way we should be calling the organisation in Wales, we'd love to hear that in the chat as well. Probably seems like a little question, but actually it's really important that you have some ownership of the organisation that's going to represent you. Oh, and it would be a tie, wouldn't it? Oh, okay. So IGPM W. Oh no, we're back up again. Okay, so it's a heat, Gareth. I think that means you'll probably have to go out to your Welsh Practice Manager Facebook group and ask that question again, unless we can persuade the person that says just straightforward IGPM to put in the chat which one of the other two they'd prefer, and then we could have an answer. So if you are struggling with Menti, you can put any other questions or comments in the chat box. Oh, I choose one, but would now choose 3. So you would choose IGPM Wales in brackets. Okay, so that sounds like we've got an answer, Gareth. IGPM Wales in brackets. Happy with that? I think he's nodding.
Yeah, absolutely, yeah.
Great. Okay, so how can you, Gareth, represent practice managers and do the day job?
Good question. So I've been a business manager in general practice now for over 9 years. Before this, I had experience working in health boards in both primary and secondary care. At the moment, I'm working, well, feels like 40 hours, but it's not. It's 37.5 hours condensed into four days. So I work a long days for 4 days, and then I have free time on a Friday. So I've at least one day to dedicate myself to the role and supporting IGPM, and just obviously take on board then any sort of views, any issues, anything that's bothering general practice managers in Wales, and just ensure that there's some degree of representation. As many as most of you will know on the call, I'm very passionate about general practice, and I'm very keen to ensure that the practice manager voice is listened to in Wales.
And I think it's great to have that that one voice that's acting as almost a funnel, really, so that we all know how to contact Gareth, and he is that respected member of our wider team that can go out and sit on those boards and talk to the people that really matter in Wales. So we're delighted. So question for you. How best can Gareth represent you? What kind of things can Gareth do? Where should he be? What should he be doing? How do you want to contact him? All those kind of things. So on your Menti now, you should be able to write a couple of lines, or again, put it in the chat. Oh, I can see Gareth's put his email address in there as well. Gareth, you're on Twitter, aren't you?
I've actually come off Twitter for a short period of time. I'm taking a social media break.
Oh, yeah, that's probably very, very sensible.
I know, that's for various reasons, but yeah, so it's a natural break at the moment.
Okay. Yeah, peer support, that's a good one. And be their voice, and you can certainly do that, Gareth.
Yeah.
Oh yeah, have a voice when contracts change. Yeah, and all that negotiation. So the IGPM isn't a negotiating body, but certainly our intention is, and it has been in the past, that we work really closely with the GPC, BMA, all of those organisations, and the Welsh equivalent of those as well. Hold feedback events with managers. So I know, Gareth, you're getting involved with the Welsh Practice Managers Conference, aren't you? That's likely to be October, November?
November the 17th is the date, so that's been set.
So you're gonna be holding court there? You're gonna have a slot on the agenda?
Correct. Yeah, probably be coordinating that as well as facilitating the day. So if anybody's interested, let me know.
Okay, so that would be, you know, they could let you know what kind of speakers they want, what kind of information, that kind of stuff as well. Have you got a?
Yeah, so the conference is going to be, at the moment, we're probably looking at it being over possibly 2 days, but that's yet to be confirmed. So there will be keynote speakers. There will be sort of sessions, breakout sessions throughout the day. So yeah, it's all being worked through at the moment. And if anybody's interested in getting involved, just contact me by my email address. We'd be very happy to have people engaging with us.
Great. There's some really good examples here of kind of your work plan, Gareth, of things that that we can pick up on outside the meeting. So thank you so much for. Oh, someone's asking in the chat. Joanne's asking, is it in? Is it in South Wales?
So I just put in the chat. No, actually, we're trying to incorporate North Wales as well. So we've got Deb Kraji, who also a IGPM regional rep, who's also involved in just ensuring that, you know, there's something for everybody, including our North Wales colleagues. So that's being worked through at the minute as well. So. And
will the location be in a midpoint?
So, so the location at the moment is possibly South Wales, but with a live stream to North Wales, but with facilitators at North Wales as well. So the breakout sessions will be specifically for North Wales, but obviously the keynote speakers will be live streamed essentially. So.
Sounds great, and sounds like something I wouldn't want to be involved in that IT setup, Gareth. So you're absolutely the right person to lead on that. Okay, so what do you think is the future of practice management in Wales? Have you got any views on where we're going?
Well, certainly there's been a lot of changes recently, particularly with the new contract. So there's a real emphasis at the minute on accelerated cluster development, which forms part of the work stream by the Strategic Primary Care Programme. And there's definitely more of a push to force us to work together more closely as practices, but also as contractor professions. So of course, you know, the plan is to incorporate pharmacies, dentists and optometrists in terms of shaping, if you like, what the community needs are. So that's very interesting. It's very early days at the moment, but you know, it is being worked through, and health boards have got the responsibility to deliver that. So that'll be quite interesting. As most of you will probably gather, doing the day job, there seems to be more and more push towards us as practice managers, pretty much away from the clinical side of things. So the current bean counting that we're doing for the GP activity project, for QI project. So yeah, I think going forward, we need proper continued professional development for us, and we need more support as practice managers in Wales. And this is where I think, you know, me becoming Associate Director for Wales, for IGPM, is where, you know, hopefully we can help shape what practice management looks like in the future for us, rather than it being dictated to us. So I think that's quite important. We'll still be suffering with, you know, huge demand, lack of capacity, decrepit estates, lack of investment, and obviously we'll need to keep fighting for funding. So these are areas that we'll probably need to continue to highlight. So
yeah, and all of those things are replicated across the bridge as well. So we do, you know, we do have tons of similarities with you.
Yeah.
Okay, so how will you make sure all the stuff is relevant? I mean, I know we could just take out the terminology, but there are they're the kind of big glaring differences, but there's some more subtle things, isn't there? So how do we make things relevant?
So I think, part of this is engagement, and engagement is going to be key, really. We need to ensure that IGPM will continue to make sure that Welsh practice managers' voice is heard, and every aspect of IGPM covers Welsh practice managers or practice management. So, as you know, Kay, we've recently had IGPM, or the Institute of General Practice Management, translated into Welsh, which neither I can pronounce or you can pronounce.
I certainly can't, no.
As a non-Welsh speaker, I think I need to brush up on my my Welsh speaking skills, and ensuring that anything that's published, obviously, particularly if it's patient-facing related, is available bilingually. But ultimately, I think we need to do things for Welsh practice managers for the future, and this is part of the things that I'm sure we'll continue to do. So yeah.
Gareth, Anne's just put a comment in the chat, which sounds like a really simple and great thing to do. Set up a shared calendar for practice managers with task reminders. For a man with your IT skills, is that simple to do?
Well, in Wales, we're supported by Digital Healthcare Wales, so it is a really good idea, and perhaps some low-level engagement with them might be worthwhile to look at that, because there are going to be things that we're all doing, on a monthly, quarterly, annually basis, and just having those sort of prompts and reminders, I think it would be really helpful. So yeah, thank you, Anne. That's a really good idea.
Yeah, we might try and steal that one as well. Okay, so our question really to you is, how can you support Gareth so that Gareth can do his job? And all these things, all these ideas that are coming in, what can you do to help Gareth? So any ideas, either in the chat or on Mentimeter. So it's the same code, 2981 3102, and it's menti.com. And I can just see Juliet's put in the chat, our health board set up a shared PM group with task reminders via Teams. Gareth, I assume that's not the same health board as you.
No. So this is part of the problem we have in Wales, is that each health board has different ways of working. So what might necessarily be available in Cardiff and the Vale might not be available to an Iron Bevan, and what's in an Iron Bevan might not be available to what's in Betsy. So there's no standardization across the health boards. It's quite ironic actually that they want us to work in a standardized way. Yeah, all the 7 health boards in Wales don't.
But that's exactly the same in England. PCNs work differently, CCGs work differently. Well, and goodness knows what ICSs will do when they start on the 1st of July. So a couple of examples, couple of ideas. So sharing examples of what works well and flag up issues. I think, Gareth, you'd be really pleased to hear local issues, things that you can help with.
Yeah, certainly. I mean, I'm quite happy to provide any sort of I don't want to say counselling service. I want to say something like a supporting arrangement.
Yeah, I mean, we do sometimes get questions as the kind of IGPM office where we look at them and think, actually, this person needs some support from ACAS or needs some support from their LMC or from somewhere else. So we're really strong on saying, actually, what you need for this is somewhere else. But being that coach is a great thing.
Yeah.
Somebody's kindly put sign up to the IGPM. So it does just cost £50. So you don't have to go through the accreditation to be a member of the IGPM. Is £50 a year. We've kept it at £50. So if you paid last year, it's the same fee this year. And all that does is help us to keep going, to pay for wonderful Ali to do our support in the background. and to give us that opportunity of membership by numbers. So governments and other bodies listen to us because we've got over 1,000 members. So as that number increases, we get a kind of bigger seat at the table. People will take notice of us. So you can just go to the IGPM website, and I'm sure one of my colleagues will put that in the chat if you want to join. So Gareth, what do you need from the practices?
So essentially, we need more Welsh practice managers to consider being a member, which is going to be beneficial to them. Not only to say that they're a member, but to have the support, encouragement, and a voice from IGPM itself. I mentioned earlier that Deborah is one of the regional reps, and I think, you know, what we do need are more regional reps. So if we're able to get regional reps down in West Wales, Mid Wales, as well, I think that would be really beneficial going forward for us. And basically as well, share everything that IGPM publishes, information, tweets, retweets, shares, and get your management teams in the practice involved as well. And it's probably worth saying that, you know, this is not just about practice managers, this is about practice management. So you may have a deputy, you may have an IT manager, you may have an office manager or reception manager who can all essentially be members and all go through sort of an accreditation process as well. So
great.
I think that's worth pointing out and highlighting.
Yeah, definitely. And sometimes practices get bigger, and so there's more of those management roles. I'm just looking at the chat, and I'm delighted. There's at least 2 people who are saying they want to help support from their location. So that's amazing. Thank you to Deborah and Carl for volunteering to do that. We'd be delighted to have you as members of the IGPM and work towards being regional reps. Okay, so what's the first thing you're going to be working on, Gareth?
So it's interesting, isn't it? Because it's like a job interview, this. But as you know, I started early engagement and involvement with IGPM primarily because of my frustrations around the lack of recognition for practice managers, the fact that Welsh Government didn't see us as a professional, which, you know, was frustrating. Things are subtly changing, and I think as we move forward now, certainly, you know, we're sat at a couple of tables, myself, Deb, and another practice manager, and the voice is actually being listened to and heard more. I think that's quite important. I mean, you've got now practice managers who have become essentially cluster leads in their area because of the lack of clinical people willing to step up into the role. So, you know, that just demonstrates that things are moving quite swiftly and changing. The sort of landscape is changing. But in terms of the first thing, engagement. I suppose that's the key focus for me at the moment. Is just engaging with RCGP Wales, BMA Wales, LMC, and just making sure that, you know, there is support from those bodies to help us shape things for IGPM in Wales. So we've been setting a little bit of or setting the scenes with BMA, GPC, and RCGP Wales. So there are some early shoots of support which are developing, which is very good. I'm trying to work now with the Strategic Primary Care Programme and Health Education Improvement Wales to try and invest in practice management, continued professional development, and potentially provide a platform for Welsh practice managers to go through the IGPM accreditation, and you know, for everybody to be finally recognised as professionals in their role, which, to be fair, has been long overdue if we compare you know, to our clinical counterparts. So yeah, thanks.
Great. Not much then. Not much on that list. Okay, so is there anything else that should be on his to-do list? I think that was quite a long list of things, but is there anything Gareth's missed or we've missed? Oh, and I can just see that Ali's done the total numbers, 10,082 members across the UK. Sorry, 1,082. Did I say 10,000? 1,082. Pushing back against silly targets.
Yeah,
So maybe. Sorry, go on.
Yeah, I know. I think this is probably one of the areas that is potentially a strong point for me, because I co-wrote a BMJ Life article with Dr. Goodfellow in relation to the previous telephone targets, which actually still exist, but we don't need to report on them, which is a bit weird, because if we don't need to report on them, why are we putting that data into a pathetic dashboard? But still, that paper did actually sort of indicate to Welsh Government that it wasn't about improving patient care at all. It was all focused around a stupid target, effectively. Answer 90% of all calls in under 2 minutes in general practice. Are you for real?
Yeah. And we've had some similar successes in with the English NHS. So just being at the table makes a difference in how they think, because they then understand what impact that has to us and to our patients, and whether it will actually make the difference that they anticipate. Yeah. Okay, so what makes it better to be a practice manager in Wales, Gareth?
Oh, I'm going to tempt you over the bridge now, aren't I?
Yeah, I'm already tempted. I'm already tempted.
Well, I mean, firstly, I probably need to start off and say that in Wales, it's a beautiful country. One of the benefits, or one of the pluses of COVID has meant that I bought a caravan. I've been quite sort of traveling a lot and getting to see many parts of the Welsh coast, which are absolutely amazing. So Robin, when you come over to Pembrokeshire, you'll have the delights that we have so close to us. But it may not seem like it sometimes, but as a small country, we've got a government who are actually willing to engage and listen, and that is quite rare, if we compare to the current English government. So, for example, under the new contract, non-clinical staff now can benefit from the partnership premium scheme, something that's not actually available anywhere else in the UK. Like I said before, we've got practice manager representation on many national and local groups, where the practice manager voice is now making a difference after being heard. Some of us have been on fortunate to have gone on the Confident Practice Managers programme, supported by Public Health Wales. So we just need to make sure that that the momentum continues, and that we as practice managers sort of benefit from personal development and our training in order to make us better practice managers and support us going forward. So as part of our career. So I think that's probably one of the things I'd say, is that although it doesn't feel like it, there is that degree of support, and we are being listened to. So that's the key thing, really.
Yeah, and that accreditation, the IGPM accreditation, will mean that we're not only proving about ourselves, but we can give the ones that are following us, because it's really important that there are people following us and showing them that this is a career path. So you're working, do you call them HEIW, H-E-I-W, isn't it, HEIW?
Yeah.
Yeah, working with that organisation will mean that they can tailor the courses, the qualifications, the things that they do with our accreditation, so that people have a better path to go along.
Absolutely.
Okay, so just as we come towards the end, we've just got about 5 minutes left. Has anybody got any questions for Gareth or for any of the IGPM team? There's only, there's a smaller number of us, so I'm really happy if you wanted to switch your microphone on and ask the question, or you can do it in the chat or on Menti. Just remember that we are being recorded, so that this can be picked up by other people that couldn't make it today. Can't see any questions coming in. So Gareth, you've put your chat, haven't you? Your email address in the chat.
Yeah.
Do people expect that messages come out from you on a Friday then? Did you say Friday was your day of not being in the practice, or are you going to be a bit flexible about that?
Well, you know, I'm flexible. My email address is there. If people want to contact me, that's absolutely fine. I've got no issues. I get huge numbers of emails anyway, so a couple of more is not gonna hurt. But you know, just bear with me if I'm slightly, you know, behind in responding.
So we've got a question: how can we better get across joint messages about the challenges to primary care in Wales?
I think again, this goes back to engagement and the voice side of things. Really, is that, you know, we need to start engaging properly with the relevant bodies, the health boards, you know, the Welsh government, just to sort of say, look, you know, these are the challenges that we're facing as practice managers on a daily basis. And also, don't forget that, you know, if you are having issues and challenges, that, you know, we can firm up some sort of conduit where, you know, if you wanted to email me directly, and we can, you know, I can run it past, you know, relevant people. You know, we can talk to GPC Wales. The links are there already. So, you know, again, these are the things that we need to look at. But again, we just need to remind ourselves that we're not a negotiating body, and the LMC and VMA will quite rightly remind us of that. And but it's about us working all together, essentially, to sort of highlight these challenges that we're up against.
Fabulous.
Just to add to that as well, you know, in England, where we've had new contract stuff come out to us that most of us have gone up in arms about and thought, this is ridiculous, how's it going to work? We haven't been the only ones. So we've teamed up with the BMA and the GMC, the GPC over in England to release joint statements about issues that we're concerned about. So having our voice added to theirs also creates a lot more influence. So it's, you know, Gareth's going to be a key conduit in making sure those relationships are built up, but he can't do it in isolation. So he needs to hear from you guys on the ground. What are the biggest issues that are impacting on you? So you need to make sure that those channels are open and they're being utilized to make sure that joined up messaging gets out there.
Exactly, yeah.
Okay, so Gareth, I think you had at least 3 people, if not 4, within the chat volunteering to help, to support, to be regional reps. So we'll capture that information. We've got your email addresses from your signing up to this webinar. So we're just to reiterate really that the IGPM is committed to making this work in Wales. We're committed to supporting Gareth and all of you, because we know that although there are those bits that are specific, you are having the same struggles as us. So we just want to make sure we get the detail right, and that's where Gareth comes in. Gareth, do you want to end with anything? Are you happy? You've passed the interview, of course.
Yeah, I think my my interview went really well. No, I think, you know, it's been a long time coming, and I know, thanks to everybody for taking the time to join the webinar today. I think, you know, the feeling is that, you know, we do need a voice in Wales. We need to drive things forward as collaboratively as practice managers. So there are things you could do. Oh, well, the slides come up now. So there are things that you can do to help us. So tweet and include IGPM and prominent people in the area. Speak to the local LMCs and ask them for support for IGPM. Any ideas you've got for funding in order for us to sort of take forward any future webinars, training, any other needs. Tell your GPs as well in the practice about IGPM, because if you're going to go through the accreditation, you know, they need to be aware of it and build that into your annual appraisal or continuing professional development. Because I know that a lot of people haven't had annual appraisals for some time, so this might be the sort of the catalyst to do that. IGPM is not a threat, it's something to help us in our roles. Tell everybody in terms of your colleagues about IGPM, get your staff involved to support membership. If you are a member, add your logo to the email footer, and if you haven't got that, we can make that available. Talk to us about ideas, support your regional reps, although at the moment we've only got Deb, but obviously we've got some volunteers going forward, so we'll make contact. And also, well-being is key. So look after yourselves first. Take that time out in the day. I don't know if you get emails like I do from Outlook, which tells me set time aside or a relaxed time. I use them quite often actually, so they got slots. I got slots in my diary just to think and have some thinking space. So yeah, thank you everybody else. Thank you for joining. Really appreciate the support, and look forward to making contact soon.
Thank you, Gareth, and thank you everybody for being with us today. And stop record now, Ali.